Welcome back to Boom and Bust. I'm your host, Tony Clement, having my conversation with Harrison Fleming. He is the Director of Policy and Legislative Affairs at secondstreet.org. Harrison, earlier in this interview, you were talking about Quebec on certain matters. I think you mentioned Alberta as well. Are there provinces doing better on wait times than other provinces?
You know, it's tough to say better when so many Canadians are losing their lives while waiting for healthcare. We certainly know Atlantic Canada faces larger challenges in terms of wait times. But the problem is pretty stagnant across the country. It comes into a larger focus in certainly rural communities, and that's true in every province across the country. And so one of the things that we're actually seeing as a result of that is Canadians are starting to hunger for healthcare reform. There's starting to be
Right.
this feeling that, as you mentioned earlier, maybe 20 years ago we would say we had the best healthcare system in the world, but now people are sort of starting to feel like they're not being served the best. And so we've seen that in some polling that we've done, where now 73% of Canadians are actually in favor of a program like the Cross Border Directive. And more than two-thirds of Canadians are in favor of allowing private options for Canadians on wait lists in Canada. So we see that there's starting to be some drive for healthcare reform. And, as it is a problem in every province in this country, it would be great to start seeing a champion stand up and be the voice of healthcare reform on that stage because it really does need to happen, and the public's ready for it.
Well, that's what I was going to ask you next. You've hit the nail on the head here. It actually is very surprising to me that healthcare is not a bigger hot button issue in our political discourse because the results are so poor now. And now I know Trump tariffs and everybody's focused in, or at least the media is focused in on that. But when you've got over 17,000 people dying waiting for healthcare just last year alone in this country, surely to goodness, it'll percolate up as an issue when the next federal election rolls around and the next provincial elections roll around too.
Yeah, it is one of those things. But you see always when healthcare is brought up, there's sort of the meta scare tactics that happen, and people say any reform is going to be bad. And so eventually there needs to be some political courage to get through that because the public will reward concrete action that gets people care faster. We know that to be true. At the end of the day, if you can reduce wait lists in this country, it's going to save lives and it's going to make people's lives even better. So I don't know why there's this holdup here because there really should be some political will to get it done. Um, One thing that's interesting is, there's this viewpoint that only rich people will travel abroad for healthcare right now. And
Mhm.
Second Street wanted to look into this. So last year we did some polling and we found about 11% of Canadians are seeking healthcare abroad. Now that might be in another province paying out of pocket privately or going internationally. But it's about 11%. And what's the most interesting to me about that is it's about 10% of people making above $150,000. It's about 11% of people making $60,000 to $150,000. And for those making under $60,000, it's still about 10% of Canadians who are making that choice. Because at the end of the day, if it is your life or the life of your loved one on the line or the quality of their lives at stake, you find a way to make it work. And I found that to be very interesting is that across income brackets, people are still choosing to get healthcare when they're faced with those incredible wait lists in Canada. And so as much as people say private healthcare only is helping rich people, we're seeing people across every income bracket make the choice to take better care of themselves because the government system isn't looking after them.
Yeah, that's a very interesting point, Harrison. That really everybody is affected by this, and I mean, you can make the argument actually that the lower income scale they bear the brunt of this because they have fewer options. If they can afford to go elsewhere, they do. But I guess for those 17,000 people, uh, that didn't come soon enough. So we've got about 10 or 20 seconds left. Any final thoughts for our audience?
Well, just in case you think that we're spinning these numbers somehow or that this information could be tilted for some political purpose, I encourage everyone to check out secondstreet.org. All of our reports, we source them, all of that information you can find at the end, links to all of our FOIs and all of the responses we get from those governments.
Fantastic. Harrison Fleming, keep doing the great work over there at secondstreet.org. Great to have you on the program today.
Thanks very much.